Hello everyone, I am Dr. Chinnababu Sunkavalli. I am a robotic surgical oncologist at Yashoda Hospitals, High-Tech City, Hyderabad. Today we are going to talk about cervical cancer. Cervical cancer is the second most common cancer affecting women in India. The reason we are discussing about this disease is because this is a preventable cancer. Most preventable cancer is not prevented. Unfortunately, many people are not aware of why cervical cancer happens. Cervix is the mouth of the uterus. It is the entry point of the uterus. So, if the cancer of this part is usually, to begin with, is symptomless. Initial phases, there may not be any symptoms. That's why screening is very important. Screening helps in early detection of this cancer. The most important cause for cervical cancer is human papilloma virus infection. HPV infection is a simple virus which is very commonly seen. No, it is not a rare infection like HIV or hepatitis B or HCV. This is a very ubiquitous infection which most commonly it spreads through sexual transmission. So the HPV infection over a period of time can lead to cervical cancer. I mentioned already, screening is very important. From infection to cancer transformation, usually takes about 5 to 10 years in cervical cancer. So you have a window of opportunity to detect this disease very, very early. So the late presentation, many times the symptoms for cervical cancer could be bleeding per vagina or bleeding after intercourse, or it could be foul smelling discharge or excessive white discharge, back pain, or sometimes if the disease has spread to other parts, you may have symptoms like weakness, backache, and fatigue and loss of weight. All these symptoms can be seen later. But in the earliest part, many times it may be asymptomatic without any problem at all. We can do a simple test called pap smear, or we can also do a simple test called HPV testing. Human papillomavirus infection testing can be done above 30 years. Get this test done once every 2 years or even once in 3 years is good. After 40, do it yearly once. If you are looking at prevention of this cancer, a vaccine is available. Please talk about this vaccine. HPV vaccine is the one best way of eradicating or eliminating this cancer from this planet. I request each one of you to spread this message. Teenage girls from 9 to 11 years, before marriage, this vaccine should be taken. 2 doses or 3 doses based upon your age. If you take after 15 years of age, 3 doses, 0, 2 and 12. Or if you are taking at 11 to 12 years of age, 2 doses are sufficient. You can take today 1 dose, the second dose can be taken at 6 to 12 months of gap. So this is a very vital information. Please talk about this with your doctor. Reach out to the healthcare professionals for information on this vaccine. This is not like a COVID vaccine or some other vaccine which causes, you are apprehensive about the side effects. This can eliminate cervical cancer. I request everyone who is watching this video to please spread this message. You share this with the 10 more people whom you love, because a preventable cancer is not prevented. That's my pain point. Please share this video to as many as possible and encourage, whomsoever you know of, encourage them to talk about HPV vaccination for prevention of cervical cancer. That's my clarion calling today. That's a call of action that I want to give to everyone. Spread the news, awareness about cervical cancer prevention. Let us all together beat this disease and overcome this disease. Thank you so much for watching this video.
Like, comment, and subscribe for more health updates.